From Southern California, this is The Circle of Insight, a show about everything in psychology. Hear the latest in news and views on psychology. Our motto is simple: wherever there is psychology involved, we are there. And now, here's your host of The Circle of Insight, Carlos Vasquez.
From wherever you are around the world, welcome and thank you for joining us. Today we're going to be exploring medical myths. That's right, we have an expert with us, Dr. Stephen Novella. He's an American clinical neurologist and assistant professor at Yale University School of Medicine. Dr. Novella is going to help us out with these medical myths. Welcome to the Circle, Dr. Novella.
Thanks for having me. Great to be here.
This is a really fun topic, but also a very important topic, because I get the funny feeling a lot of stuff is being hyperbolized out there in the world of the media. Who knew, right?
Right.
Now, Dr. Novella actually wrote a series of ebooks called they're based on science-based medicine. That's what the books are
right.
on. He's also got a wonderful podcast called The Skeptic's Guide to the Universe. You definitely want to catch that. So I think we're going to start off with some of these myths right off the get-go. Is that okay?
Yeah, let's go.
All right. So this one's fascinating to me. 8 glasses of water. For those people who have bladder issues, this might be good news. Are they really good for you to stay hydrated?
Well, it's definitely a good idea to remain hydrated, but the 8 glasses of water a day is a myth. It's not really based on any hard science. How much water or overall liquid you need to drink in a given day is variable. You can't put in the same number on it for every person in every situation. How big are you? How much water are you getting in your food? On average, about 20% of your fluid intake is going to come in through the food, so it depends on how wet or dry the food is that you're eating. What's your altitude? How physically active are you? How dry is your environment? How hot is it outside? Fortunately, you don't have to keep track of all those variables and calculate how many glasses of water you need to drink. All you need to do is, if you're thirsty, drink. And for most people, most of the time, just follow your thirst, and that's fine. Now, if you're going to be in an extreme environment, if you're running a marathon, going to be in the desert, etc., you may need to try to keep ahead of your hydration by drinking, consciously drinking, because by the time you feel thirsty, like I go to a conference in Las Vegas in the middle of the summer. By the time you feel thirsty, you're probably already dehydrated. So in that kind of situation, you got to make sure that you have fluid with you. You are able to hydrate. You may want to pre-hydrate, try to keep ahead of it. If you're going to be on a long plane trip where the air is really dry, you might want to consciously hydrate. But most people in everyday situations, everyday activity, if you're thirsty, drink, and that's probably fine.
I wish I would have a camera on all the audience right now, because I get the funny feeling over 50% are probably trying to take a drink as we talk about this. Now, is there anything that can dehydrate us? I know I've heard stories about the heater. You turn on the heater during the winter, that can dehydrate you. Is that true?
Well, it depends on the kind of heater that you have. Some heaters really dry out your environment, and you'll know it. You'll feel that the air is dry. You might get a dry throat or dry lips, etc. If that's the case, you either do need to hydrate more to keep up with it, or you get a humidifier. Humidifiers are very effective. Just compensate for the drying out of the air depending on the kind of heat that you have.
I want to take this into a little different direction, but there's another rumor that I heard a while back ago, and I can't remember who told me this, but they were saying the color of your urine also will dictate it. If it's really dark yellow, you need to drink more water.
Yeah, that's a good rough estimate of how hydrated you are. If you're dehydrated, your body will hold on to water and concentrate your urine more. And so if your urine is coming out very dark, that could mean that you're dehydrated. If you're keeping well hydrated, your urine will be very pale. But again, that's most people. So there's other things that could affect the color of your urine, and none of this general advice would apply to people with specific medical conditions. So always follow the advice of your physician if you have kidney stones or otherwise have kidney problems or heart problems. Some people need to keep dry if they have heart failure, for example. So obviously, if you have any medical conditions, talk to your doctor. But for otherwise healthy people, average person, yeah, I mean, the urine is a rough estimate of how hydrated you are. But again, you shouldn't be using that as your indication. Again, you evolved to be thirsty when we need water, and our bodies will tell us when we need to drink.
Excellent. Last question on the water, then we'll move on. Any differences? I know some people advocate distilled water, for instance. Some people advocate waters that have reverse osmosis. Anything really to that?
No, not really. Water's pretty much water. There's no magic water out there. There's 100 versions of magic water. Just ignore all of it. Alkalinized water, all that stuff is nonsense. Distilled water is actually not good. It's not what you should be drinking. You need those minerals that are in the water. So distilled water is taking out minerals that your body actually needs. It's not necessarily dangerous to drink distilled water, but it's not good for you either. I wouldn't recommend that at all. Just regular old water is fine, as long of course as it's clean and not contaminated with anything. But we have really good water in the United States, for example, as most industrialized nations do. It's a problem in other parts of the world, but if in the West, the water out of your tap is fine.
Interesting. All right, we'll move on. Now we're going to head to the world of vitamins. This one had a bad study that came out for them a couple of months ago, if I remember. I think it was like 6 months ago, where they said they don't do anything for you. So does vitamin C?
Yeah, so I mean, vitamins in general, it's a bit of a complicated story in terms of interpreting the data. The one thing we don't have with like a multivitamin, for example, is randomizing people to taking vitamins or not taking vitamins. The studies are all looking at people who decided for themselves whether or not they wanted to take vitamins and then just seeing how they do. So whenever you have a study that's an observational study like that, where you're not deciding who gets the treatment or not, then there could be all kinds of biases in the data. For example, people who are healthier may take multivitamins and do other things to keep themselves healthy. They're health conscious, so it's part of an overall package, but the vitamins themselves may not be doing anything. Or people on the flip side may take vitamins when they're sick. And so if you look at who's taking vitamins, it's the sick people. But they're not sick because they're taking vitamins. They're taking vitamins because they're sick. So when you look at all the data and all the different studies, the bottom line is we don't see much of an effect at all from taking a multivitamin, just in the general population. And some studies even show, especially if you take high doses of certain vitamins, it actually could be detrimental. Vitamin C is one of those, actually, like super high mega doses, of vitamin C and other antioxidants, in fact, could be linked with increased risk of heart disease.
Really?
So
Wow.
yeah, so there's no evidence that vitamin C, makes you healthy or prevents disease. It's been studied up and down for the common cold, and at best you could say that, there are some studies which show that the symptoms may resolve on average like an hour quicker, than if you're not doing anything, which is nothing. I mean, it's clinically insignificant. It's such a small effect. It's just noise in the data probably. And if it's a real effect, it's insignificant. So it's just not worth doing it. You're better. There's also often an unintended consequence that we get worried about. So there's one question is, what's the effect of taking vitamins? Another effect is, what's the effect of telling people they should take vitamins, which are slightly different things. If people are taking vitamins and they think that it's healthy, then that may justify not having a healthy diet. It's like, well, I don't have to try so hard to have a healthy diet because I'm taking a multivitamin, I'm covered. And so they don't eat as many fruits and vegetables as they should. And the data clearly shows that eating fruits and vegetables is healthy, and taking a vitamin doesn't substitute for that. So people may be unhealthy because they're taking a multivitamin, and that's justifying not having a great diet. When all the data shows, and I think everyone agrees who looks at the data, the best thing to do is to eat lots of fruits and vegetables, have a healthy diet. That's what you really should be doing.
Who would have known?
But it's a huge industry. Yeah.
On the vitamins, does your body process it differently when you're taking a multivitamin compared when you're getting it from fruits and vegetables?
No, I mean, the vitamin's a vitamin. Doesn't really, I mean, people will tell you that natural vitamins are better than synthetic vitamins, whatever, but they're not. They're chemicals. They're all, once it's in your body and broken down to like the vitamin C, it's vitamin C. It doesn't make any difference where it came from. The only difference would be in bioavailability. So in other words, how much are you getting out of the food? But once you get it out of the food or the pill or whatever into your system, it's the same molecule. So that doesn't matter. But again, there's a difference between eating a healthy diet and taking a supplement. Supplements are useful if you're deficient. So some people need vitamins because they just not absorbing it well, or they have dietary restrictions or whatever. They have gastric bypass. There's lots of situations in which people should supplement. So don't get me wrong. Nutrition is real. Vitamins are science-based, and when you need them, you need them. My approach, with my own patients, because there are some neurological things that I treat that can be associated with vitamin deficiencies, I just check their levels. And if their levels are low, I supplement until their levels are good, rather than guessing or just non-specifically giving them vitamins just because. I think that's a better approach. But general supplementation, there's no evidence of any benefit, and it may, in fact, be a detriment.
So if you actually had a patient that was low on vitamin C, would you recommend a vitamin or try to get them to take like an orange or something like that?
Yeah, we don't really measure vitamin C levels because it's such a short-lived vitamin. It's, it comes, you just pee out any excess. So you just need to be getting enough in your diet. And there are certain situations where you need extra vitamin C, like if you're healing from an injury or a surgical wound or something. So we just supplement during times of need. But it's not one that we measure levels for. But like B12 is a common one. If patients are B12 deficient, which can have neurological effects, so I check that frequently, then I will tell patients what foods have a lot of B12. But if you're deficient with that particular vitamin, you're probably not absorbing it well. And so I give them a pill, a supplement pill. And then even then, that may not be enough, and they may need injections. So you have to just follow them and see how they respond to whatever intervention you're doing, whether it's a dietary change versus a supplement versus whatever they need. But each vitamin is different too. There are fat-soluble and water-soluble vitamins. Vitamins, have different ranges of what's tolerable. So you can't make blanket statements about all of them either.
On vitamin B12, you made an interesting comment there. You said that was a common one among your patients. Is there a reason for the deficiency? Yeah. Is there something going on out there? Is it environmental issues, stress?
No, so B12 is unique among the vitamins in that it is hard for your body to absorb it. Your body needs to secrete a protein in the stomach called intrinsic factor, which binds to the B12 and brings it across into the blood. If you don't make enough intrinsic factor, you can't absorb the B12. And some people are just deficient in it. They have B12 deficiency from a young age. But also as we age, our ability to absorb B12 can decrease over time. So I see a lot of older patients because, that's who gets sick, right? As we get older, we get sick. So that's any patient population is going to be disproportionately older unless you're a pediatrician. So just because I have an older patient population, a lot of them just aren't absorbing B12 well, and they're deficient. And so I supplement them to keep their levels up into the normal range.
Interesting stuff. This is good stuff. So let's continue moving on. We're going to leave the world of vitamins. It was funny. I had a guest on here a couple of weeks ago. We were talking about natural foods, organic foods, compared to the regular food. Is there a difference there?
No, we could say that pretty much unequivocally. So there's been 50 years of studies looking at the nutritional value of organic versus conventionally farmed foods, and there is no significant difference. Now, proponents will often point to one study here or there. They'll cherry pick studies saying, yeah, look, there is a little bit of more of this kind of vitamin or that kind of vitamin in the organic produce. But the studies are a little complex. First of all, you have to make sure that you're comparing the same cultivar, like the same kind of tomato. You can't grow one kind of tomato organically and a different kind conventionally and compare them. So there could be differences that have nothing to do with the fact that they're being grown organically. But when you control for all those other variables, what we find is that the organic fruits and vegetables are a little smaller. And because they're a little smaller, everything is a little bit more concentrated in there, So sometimes the concentrations are a little bit increased, but that's just because they're smaller. That pretty much accounts for that. And in any case, so some studies, most studies for most nutrients show no difference. And when there is a difference, it's really insignificant. So that's another case where if you're buying organic produce thinking it's more nutritious, first of all, there's no significant difference. You're probably paying more, 150%, maybe even twice as much. People will buy less because it's more expensive. If you end up eating fewer fruits and vegetables because they're more expensive, by buying organic, you're actually going to be getting less nutrition than if you just buy affordable, conventional produce. The other issue that comes up is pesticides. Yeah. So there's definitely more synthetic pesticides on conventionally farmed fruits and vegetables than there is in organic, because organic farming doesn't use it by definition, although sometimes it still gets exposed just collaterally. But a lot of organic farmers use quote unquote organic or natural pesticides. So it depends on whether, especially the big organic farmers, you pretty much have to use something in order to prevent the pests from devastating the crop. So there could be natural pesticides, and often the studies looking at them are not looking for the natural pesticides. They're only looking for the artificial ones. So the game is rigged. Of course, you're going to find more pesticides on the conventional produce if that's what you're looking for. There's also absolutely no reason to think that the natural pesticides have a better safety profile than the synthetic ones. And when we look at it scientifically, they don't. And in fact, organic farmers often have to use more pesticides because they're not as effective as the synthetic ones. So that is really just misinformation, this notion that organic farming is pesticide free. It isn't, or that the organic or natural pesticides are safer. There's no reason to think that they are. And when we have studied it, they're not. So in that situation, I say, you know what? First of all, the pesticide residues are all well below safety limits, so don't worry about it. And if you are worried about it, wash your fruits and vegetables, which you should be doing anyway. So it's a lot cheaper also. If you just wash your fruits and vegetables, eat lots of fruits and vegetables, don't worry about organic. It really is a ripoff, in my opinion. You're better off just completely avoiding the organic, which to me, it's just all about marketing.
Yeah, that's the big problem.
Hi, welcome to Adelante. This is Adelante Recovery, and my name is Yvette Kuglin, and I'm part of the staff.
Adelante Recovery Center has helped people in dual diagnosis for 5 years. We accept most PPO insurances and provide luxury accommodations and 24-hour support. To speak with an admissions counselor, call 1-888-242-4450.
A lot of time we don't even know what's wrong with us, and sometimes we need to get away to figure that out. So if you want to go for a little retreat out in Corona Del Mar, which is a confidential location, we're here to help. So we're only a phone call away. Thank you.
Here's a question for our gastro-challenged audience members. Probiotics.
Yeah.
Do they really work?
That's also a bit complicated. So probiotics are the idea of giving quote-unquote good bacteria in a pill form or food or yogurt or whatever. It will enhance the bacteria in your gastrointestinal system, and that will promote good health. So as a general health intervention, there is absolutely no evidence and no reason to think that taking probiotics is helpful. Your gut has about 100 or so different species of bacteria. It exists in an ecosystem, and just by adding lactobacillus, you're not altering your ecosystem. It doesn't have any effect. And in fact, the bacteria that are in most of the probiotic products are not ones that you probably have in your ecosystem. They're just going to be crowded out. They're not going to have any influence whatsoever. What about taking probiotics when you have diarrhea? So if you have antibiotic-induced diarrhea, so now you've wiped out your bacteria in your stomach by taking broad-spectrum antibiotics. That can cause bad bacteria to overgrow, like C. difficile, for example. There is some evidence that if you take very high colony counts of probiotics prophylactically, like when you start the antibiotics, you also start taking the probiotics, that it could decrease the overall duration of the diarrhea. So there's a little bit of an effect there, but it's not really a very useful intervention. However, scientists are figuring out, again, the idea is great. It's just that the way it's being done now is not effective. But scientists have figured out what we need to do. You actually need to give stool transplants, which sounds icky, I know, but if you give stool, and it should be from a family member because they'll probably have the same ecosystem that you do, you're giving the entire ecosystem, not just 1, 2, or 3 different bacteria. And there was a recent study which showed, in order to bypass having to put it down a gastric tube, that you can freeze it into little pills, and you can take it frozen so you won't taste it or anything, and then it will dissolve in your stomach, and you'll get a dose of a complete ecosystem of bacteria. Now that's helpful. That approach works, but that's what you need. You need to replace the ecosystem. You just can't take 1 or 2 species that aren't really even natural to your ecosystem to begin with.
That's left me speechless. We'll continue on. Let's see what we're going to do to the wine industry now. No offense to those who love wine. Does it really help?
So you need to be more specific for me. Does what help? This wine.
Resveratrol.
Oh, resveratrol. Okay. So are there health benefits to taking wine? This is one of those questions, again, that's been going on for decades, and it kind of goes back and forth, which always tells me that there's no huge effect. If there was a huge effect there, we would have been able to demonstrate it decades ago. So the harder it is to detect, the smaller probably the effect is. Interestingly, for years, when you did epidemiological study, it looked like people who didn't drink at all were not as healthy as people who drank a little bit. And so researchers said, maybe there's some benefit to drinking alcohol, specifically maybe wine. But then it was discovered that in the doesn't drink at all group were ex-drinkers who were unhealthy because they were former alcoholics. So, but once you factor out the former alcoholics from the not currently drinking group, then that effect disappears in a lot of data. So there isn't as much of an effect there as we thought. There may not be any effect at all, just a generic effect of drinking, like having a glass of wine a day or something. But wine is very interesting material. There's lots of compounds in there, like resveratrol is one that has been looked at recently. And whenever you're consuming something that has a lot of different chemicals in there, it's certainly possible that there may be some beneficial things in there. Resveratrol, however, has been studied. The most recent studies really didn't show any effect. So again, it's in the experimental phase, but it's not looking terribly good with the most recent data. But all these things, of course, get hyped in the earliest stage of research. As soon as there's a mouse study which shows that mice live a little bit longer, then you're going to see supplements coming out all over the place, and it'll be promoted as the next miracle. But most of those things don't pan out. By the time 5-10 years later you do the clinical studies, most of those things that look interesting in mice don't end up being helpful for people. And so you have to wait for the research to mature. Of course, by the time that happens, there's already a cottage industry of red wine pills and resveratrol, whatever, the next miracle that's going to make you live forever. So that early hype is really unfortunate and almost never pans out.
Yeah, unfortunately, Dr. Oz has been feeling the pain for this one. I won't pick on Dr. Oz on this one, but we got about 5 minutes left. We got about 3 questions.
All right.
Let's see if we can get those in here.
Sure.
And thank you once again for doing this. We're going to move over to, I'm going to leave vaccines for the last question.
Sure.
I know everybody's probably itching for that one. Water fluoridation, is that good or bad?
That also has been studied for decades. What some principalities do, what some communities do, is they adjust the amount of fluoride in the water. It was found that some communities that have too much fluoride, they were getting fluorosis, they were getting brown stained teeth. This is like noticed in the 1950s or 40s. But they also didn't get any cavities. So that's interesting. And then those societies that have no fluoride in the water, very low levels, would have higher rate of cavities. So there's a sweet spot of how much fluoride could be in the water, and then either reducing it if it's too high or increasing it if it's too low reduces the number of cavities, and it's completely safe. So it's a completely safe and effective public health measure. It's been and been shown to be so with many studies. And again, we have different experiments all over the place because some communities have it, some don't have it. But whenever the government, Big Brother, is putting stuff in our precious bodily fluids, people get paranoid. There's some people who are going to be, conspiracy mongering about that. And so, the fluoridation has had this countercultural, conspiracy theory kind of anti-fluoridation movement ever since we've been doing it. And like any ideological movement, they cherry pick data, they distort the facts, they have their own reality. And that's what they're promoting. It's really easy to promote misinformation and fear, especially now with the internet. It's harder to reassure people with careful scientific studies. People are more compelled by a story, an anecdote, than they are by data. So it's it's just hard to just say, hey, look, here's all the evidence. It shows that it's safe. Obviously some people are compelled by that, but just the average person who isn't a scientist, they're likely to be scared enough by stories that they'll say, just to be on the safe side, we should, why are you putting stuff in my water? But when you look at the whole story, it's a safe and effective measure.
That's good to hear. We're going to go to cholesterol, then we'll go to screenings and wrap up with vaccines. So cholesterol,
Okay.
that was an interesting one for me.
Yeah, I mean, so that's the story of cholesterol has been very interesting over the last 30 years. So we know that there's good cholesterol and bad cholesterol. The main difference is that bad cholesterol gets deposited on your blood vessels. Good cholesterol takes it away from your blood vessels and brings it back to the liver. So that's good. It's helping your blood vessels. There was a notion in the 80s that you shouldn't eat food with cholesterol in it because it would raise your cholesterol, but actually doesn't have that much of an effect. There are some kind of fats do promote the bad cholesterol, like animal fats or hydrogenated fats are bad. The vegetable oil kind of fats, like from walnuts or from certain kinds of vegetable oils, are actually good for you, like olive oil has the good kinds of fats in it. So probably the ratio of good to bad fats is more important than the total amount. It's also important to exercise and to stay thin. So just maintaining a lean body mass, those have beneficial effects on your cholesterol. And it definitely reduces your risk of heart attacks and strokes and vascular events because it's not clogging up your arteries. There's some controversy, it's not really that much of a controversy in scientific circles, but in the public in terms of taking statins, taking drugs to lower your cholesterol. Of course, whenever the specter of big pharma comes up, but the data actually shows that lowering your cholesterol with medications when it's indicated, when your cholesterol is high, does reduce the incidence of heart attacks and death. So, I mean, these things are effective. I mean, my cholesterol is fine, but if it were high, I would treat it any way I had to because the data shows it's good for your arteries.
Is it too slow to start working out more and eating better?
Never. It's never too late to do that. But some people have genetically high cholesterol, and all the exercise and good healthy eating in the world isn't going to do it. So those people definitely need some kind of medical intervention like medication to compensate for their unlucky genes, But
Excellent point.
And if you have good genes, you could probably have a crappy diet and get away with it. But again, see your primary care doctor. They'll measure your cholesterol. They'll take a family history. Maybe in the future we'll be able to test for all these genes and know what is necessary. But got to do what's right for you based upon those things.
I always love using what I call the human health paradox, where you have Jack LaLanne, who lived to 99, and George Burns lived to 99.
Right.
It's like, there you go.
Yeah.
What do you do with that one? Last two questions. Screenings. I know those have been a hot topic again.
Yeah. We wrote about that, or David Gorski, one of my colleagues, wrote about that in Science-Based Medicine. So obviously, there are times when you should screen for medical diseases, right? And we spend a lot of time figuring out who should we screen, how often, with what types of diagnostic tests. But not all screening is good all the time. And that kind of sounds counterintuitive at first. Well, why shouldn't you screen for medical problems? You'll learn about them earlier. It'll give you an opportunity to treat them. But in the real world, there's no perfect test, right? So tests have a false positive and a false negative rate. Tests themselves may come with a little bit of risk to them. Even if they're risk-free, you have to consider what's the downstream effect of having a false positive. And if you count all the bad things that happen from having false positive tests, if you're screening in a population that has a really low risk of having what you're screening for, you may actually cause more harm than good by screening the whole population. So we may be better off waiting or just targeting a high-risk population where the benefit is going to outweigh the risk. So it's all a numbers game, right? With screening, when you're doing something to large numbers of people, it all comes down to the statistics. It's all the numbers. And there are experts. This is what they do. They spend their time trying to figure out who should be screened when in order to get the best outcome. But again, there's often this sort of naive sense that, well, all screening is good all the time, but it really isn't.
That's a good point. Last question. Everybody's waiting for this one. Vaccines. Boy, they've been getting hammered for a while. They were responsible for autism, and a big movement came against them. What's going on here with vaccines? Yeah,
so just to be clear right up front, vaccines are not associated with autism at all. That is a complete myth. But there has been an anti-vaccine movement as long as there have been vaccines. Again, the government is trying to inject chemicals into your kids. Of course, it's going to provoke emotions. And again, the answer is, well, let's look at the cold, hard scientific facts. And when you do that, it's absolutely clear. And every expert panel and society and government who's looked at this, looked at the scientific data, the World Health Organization, everybody, the evidence is clear that the vaccines that we have on the market now that are part of the routine vaccination program are very safe and very effective. It's perhaps the safest and most effective public health intervention that mankind has ever devised. It has prevented more disease and death than pretty much anything else that we have done. And it really is just conspiracy mongering paranoia that is constituting this anti-vaccine movement. They don't have the facts on their side, so they make them up. They pick and choose. They misinterpret the data. They listen to a couple of outlier experts who have an axe to grind, and they ignore the mainstream scientific evidence, which shows us vaccines are safe and effective. Get your kids vaccinated. Even for the individual, some people think, oh, you're taking a risk to protect the herd. Well, that you are protecting everyone else when you get vaccinated, but for you, your risk of harm, your risk of disease is decreased when you get the vaccine. The tiny risk from the vaccine, 1,000,000 to 1 that something serious will happen, is insignificant compared to the risk of the diseases that the vaccine's protecting against, even with the low rates of disease that we are enjoying now that we have a vaccine program. Even when, like with measles, there's 100 cases now so far this year. That's a lot. But 50 years ago, there were thousands of cases. In parts of the world that don't have vaccines, there are hundreds of thousands of cases. But even in the West, where we have very few number of actual cases, you're still statistically better off getting vaccinated than not getting vaccinated. So it's the right thing for you, for your kid, and for the public at large. It's really a win-win.
Absolutely fascinating show. Thank you so much, Dr. Novella. I know
My
people are going
pleasure.
to want to get a hold of you. Where do we go?
So if you go to theskepticsguide.org or sciencebasedmedicine.org, those are my two main portals on the internet. You will be able to get to me through either of them and to all the stuff that I do on the internet.
And your podcast is weekly?
It's a weekly hour and 20-minute science news podcast, The Skeptic's Guide to the Universe.
Wonderful. Thanks again, Dr. Novella.
Thanks for having me.
Thank you, everyone, for joining us. Remember, wherever there's psychology involved, even in medical myths, we are there. We barely touched the tip of the iceberg on this one, so you definitely want to go and catch Dr. Novella's podcast. We'll see you next time, everyone. And now we have a special feature at the end of our shows, a singer or talent of the month. This month in March, we have Rebecca Jade. And on this show, listen to Dark Out with Rebecca Jade.
It's getting dark out. It's so dark now. How did it get to this? How long on a sinking ship? The sun is burnt out of the sky. These streetlights are telling me why. Maybe black on the avenue. Can't read by the light of It's getting cold out. It's so cold now. How can you ask for help? These strangers